Good morning and welcome back, everyone. We are so excited to be moving into day 2 of the Maternal and Infant Mortality Summit and hope everyone is ready for another full and informative day. Thank you so much for your patience yesterday as we encountered technical difficulties. That was definitely a surprise hiccup. We made some adjustments for today based on participant feedback, and we are ready to get started on day 2. Next slide, please. I'd like to start with a quick reflection on what we learned yesterday. We started the day by describing the framework from which we designed the summit, the perinatal periods of risk, or PPOR analysis. We heard from Stephanie Brenhofer about the findings from the PPOR, then spent the rest of the day unpacking those findings through the various presentations. We heard from Dr. Sarah Stalick with Access, Edith DeSanto with ADHS, and Brianne Westmore with Centering Pregnancy about what their agencies and organizations are doing to improve access to care for women and infants in Arizona. Findings from the PPOR also showed us that certain factors such as low birth weight, previous preterm birth, and inadequate weight gain also lead to poor infant outcomes. To address this, Dr. Monique Lynn, Dr. Danielle Gilliam, and briefly, Julia Wafkloff all spoke about how to optimize women's health in the preconception and interconception period. Lastly, Dr. Sharon Thompson and Dr. Jennifer Richards spoke about how Arizona can achieve health equity from populations experiencing disparities in maternal and infant health, particularly African American and Native American populations, the two populations in our state that experience the worst maternal and infant outcomes. Next slide, please. Before our first session of the day, I wanted to acknowledge and extend my gratitude to everyone who has helped make this summit happen. First, to our summit planning committee that has been meeting to plan every detail of this summit since May of this year. We especially appreciate our external partners who sat on this committee to bring their honest and valuable feedback that helped us design and structure this summit. To Clark Bear, who has been the committee lead, thank you for your leadership and for all your hard work coordinating with the team. We would also like to thank Veer Consulting and all of the team members behind the scenes. We know it takes a lot of work to make events like this happen. And most importantly, we would like to thank every one of you who is participating in this summit. We hope that you will be sharing the information learned and take it back to your organizations and communities. Thank you for all you do and all the work that you do for Arizona families. Next slide, please. And now we will be moving into our first session of the day. Let's talk about safe sleep. Thinking back to the PPOR presentation, we learned that 40% of excess infant deaths in Arizona are due to unsafe sleep. What we also learned is that the majority of these are disproportionately impacting African American and American Indian infants. Providers, along with parents, want to implement safe sleep practices and are often met with challenges due to inconsistent messages, confusion, and misinformation about infant sleep safety, inadvertently leading to unsafe practices. We have asked a panel of experts to join us for a conversation about how to support families in achieving safe sleep. Next slide, please. Our session purpose will be to hear about strategies or experiences that support Arizona families to achieve consistent safe sleep practices. I want to take a quick moment to highlight that safe sleep recommendations from the Academy of Pediatrics include the ABCs. The baby should be sleeping alone on their back and in a crib, bassinet, or portable crib with a firm mattress. No siblings, no blankets, no crib bumpers, and no stuffed animals, just a baby. We know that achieving safe sleep practices can be quite the challenge, personally and professionally. Today, we will hear from a panel of experts that will share tips for safe sleep, and sometimes that includes meeting families where they are. As part of this, we will discuss strategies to address safe sleep as a primary risk factor for Arizona infants and how to include cultural adaptations while still implementing the ABCs of safe sleep. To get us started, we will begin with a review of the data on sudden unexpected infant death, or SUID, in Arizona. After the data is presented, we will then hear from our panelists where they will describe their experience working with families. Now I'm going to turn it over to Alexis Griffin, infant and child epidemiologist with the Bureau of Women's and Children's Health. Thank you, Alexis.
Thank you so much, Laura, and thank you all for allowing me to present this data for you. So we are going to start out first by looking at the Arizona versus national combined sewage rate. And from this point on, all this data is presented in a combined rate from 2015 to 2019. And we did this just to give a better picture about what's happening over a certain time period and to really take a look at some of the trends that are coming out. So as I said, these are sewage rates. So sewage stands for sudden unexpected infant death. And the definition of that is a sudden unexpected death of an infant has to be less than 1 year of age, is where the cause of death was not apparent prior to a death investigation. Most of SUIDs are due to suffocation and unsafe sleep environments, but not all SUIDs are unsafe sleep related. As you can see on this graph, the national rate is 0.92 deaths per 1,000 live births, which is slightly higher than the Arizona rate of 0.87 deaths per 1,000 live births. And over the 5-year time period, Arizona has had 389 SUID deaths, with 65% of them being accidents and 34% being undetermined. And undetermined is where either the death was the committee or the investigation couldn't determine one particular cause of death. So maybe it was between natural and accident, a homicide and accident. So we couldn't come up with a conclusion about one, or there was just an overall lack of information. You can go ahead and go to the next slide. So we'll first begin on a national overview of SUID. And again, this is a combined rate. So out of the 50 states, Arizona falls 14 out of 50 at 0.83 deaths per 1,000 live births, which we just went over. And compared to that, Vermont has the lowest rate at 0.46 deaths per 1,000 live births, and Mississippi has the highest rate with 1.85 deaths per 1,000 live births. And overall, Arizona has a comparable rate to Oregon and Nebraska. And just looking at the graph, you can see obviously the darker orange colors are going to be where the rates are higher, and the less dark is going to be where they're lower. You can go ahead and go to the next slide. This next slide gives an overview of just Arizona. So we're looking at the counties here. So as you can see, the lower rates are found in Graham, Gila, and Santa Cruz. With Graham, I will point out Graham has 0. It doesn't mean that it doesn't have any deaths. It just means over a 5-year period, it might have had 1, 2, 3, or 4. And then once we averaged it out, it was close to 0. I know that might be a little confusing. So those 3 counties have the lowest rates, with La Paz, Mojave, and Cochise having the higher rates. And their rates kind of are between 1.5 deaths per 1,000 live births, and La Paz is the highest at 2.73 deaths per 1,000 live births. You can go to the next slide. So overall, this is still on the same page comparing rural rates to urban rates. So in the Bureau of Statistics, we categorize the urban counties as Maricopa, Pima, Pinal, and Yuma, with all the other remaining counties being considered rural. So as you can see here, the rural rate is slightly greater than the urban rate. The rural rate is 1.323 deaths per 1,000 live births, which is higher than the Arizona rate and higher than the national rate. And the urban rate is 0.84 deaths per 1,000 live births, which is also in comparison lower to both of those rates. You can go to the next slide. Here on this slide, we are comparing SUID rates by gender. So you can see the female rate is again slightly less than the male rate. And this seems to be a trend that's not just in Arizona, it's actually a trend nationally and in a lot of states where the males tend to have a little bit higher SUID rates. So as you can see, the female rate is 0.76 deaths per 1,000 live births, and the male rate is 0.98 deaths per 1,000 live births. Both of these are slightly lower than, the female is slightly lower than the Arizona rate, and they are both, and females also a little bit less than the national rate. You can go ahead and go to the next slide. Now we are comparing the SUID rates in Arizona by race and ethnicity. So the 4 racial categories are Black or African American, American Indian or Alaskan Native, Hispanic or Latino, and white non-Hispanic. Asian SUID rates were not included due to low case counts. So we don't include anything that's lower than six counts per year due to confidentiality reasons. So from this graph, you can see that Black or African American infants have the highest rate at 2.52 deaths per 1,000 live births. And after that follows American Indian or Alaskan Native infants at 1.51 deaths per 1,000 live births. And both of these rates are higher than the national rate and higher than the Arizona rate. Following those 2 racial groups, we have Hispanic or Latino infants and white non-Hispanic infants. And they're all both at 0.67 deaths per 1,000 live births. And both of these racial groups are below the national rate and below the Arizona rate. You can go ahead and go to the next slide. This graph breaks down the SUID rates by cause. So we have the combined SUID rate would be 0.91, undetermined would be 0.3, and accidental suffocation and strangulation is 0.59 deaths per 1,000 live births. And just to break down this undetermined bar a little bit more, so I know I spoke about undetermined a little bit, but here's a better definition to kind of get a picture of how an infant would end up in this undetermined category. So if there is not enough evidence to determine intent, but the cause of death of suffocation is clear, then it will be labeled with an undetermined manner of death. All evidence is reviewed and cause of death is suspected, but there is not enough information to fully determine the cause of manner, then the death will be labeled as undetermined for both cause and manner. So that might be some of the reasons why an infant might fall into that 34% that we were talking about in the beginning of the presentation and why this rate is 0.3. You can go ahead and go to the next slide. So these last 2 slides break down characteristics of a SUID. So this first graph is going to break down a retrospective look at a SUID. So this is looking at the infants that died of SUID, what were some characteristics at their birth? So this is a retrospective look. So over a 5-year time period, 26% of infants that died at SUID at birth, they were exposed, they had intrauterine smoke exposure, 20% were premature, 16% did not have prenatal care, 11% were drug exposed, and 11% were NAS. So I'll also break this down a little bit. Just because an infant is drug exposed doesn't necessarily mean that they had neonatal abstinence syndrome. So those are actually 2 distinctions. A drug exposed infant might be that the mother was using drugs at the beginning, and then she found out she was pregnant and quickly quit using them. And then NAS is actually at birth, they were diagnosed with neonatal abstinence syndrome based on the delineations at the hospital. So I'll keep on going. 9% had a NICU stay, 7% were low birth weight, and 1% had intrauterine alcohol exposure. So this is a profile of the SUIDs, again, at a birth, so a birth profile. And then the next slide, you can go ahead and go to the next slide. This is a characteristics at the death. So this is how SUIDs looked at their death. So on a 5-year time period, this is a large majority, 84% of SUIDs in Arizona were found in unsafe bedding or toys. So they had unsafe bedding or toys with them in their sleeping environment. 80% had unsafe sleep environment. 55% were not sleeping on back. 54% were sleeping with other people. 14% of the SUIDs adults were drug impaired. 9% obese adults were sleeping with a child. 8% adult was alcohol impaired. 5% caregiver fell asleep while breastfeeding, and 3% caregiver fell asleep while bottle feeding. And so again, this is a look of how the profile looked at the death. You can go ahead and go to the next slide. So now I am pretty sure that the panelists will take over from now and talk further about safe sleep.